Hello, everyone. Welcome back to episode 3 of Divas Who Listen. I'm Bella, and we have Miranda here, your co host of the show. And we're picking up from where we left off 2 months ago, where we share stories that people submit to us about their experiences with the healthcare setting or in the medical field. We'll be sharing our own stories today. And the whole point of it is, we have Diva 1 and Diva 2, and we are wanting to listen and make everybody feel heard and basically bring these experiences to light because the medical field is a place that needs more compassion. So we will be listening and sharing stories to hopefully bring this to light, and maybe we'll make some change and get some more compassion.
Bella has been holding out on me of an ER visit she had recently for 3 weeks now?
Yeah, I think so, like two
Ish.
to 3 weeks ago.
Ish. It's hard when you're friends because I want to know what the heck happened when she texts me, but we're like, we have to save it for the pod. So I have been anxiously waiting to hear her story. And it's kind of cool that I'll get to react in lifetime, and then I'm gonna tell her one of my stories from years ago that I don't know if she remembers, but I'm
I
excited to
don't,
share it with
yeah.
everyone.
Yes. So the whole point is y'all will be getting our live reactions to these stories. And I haven't even shared this on I'm going to plug here, my investigator pages where I actually update people on my health and my medical condition, which is VEDS or vascular Ehlers-Danlos syndrome. I have kind of kept this story hidden, if you will, so we can talk about it on the podcast. So this will be like a first listen on the story. So what happened is just a little bit of background. I had a colon perforation at the end of 2023. So I have a colostomy bag. So my intestine, instead of pooping like a normal person would, I actually just poop into a bag from my stomach. So the intestine is connected to my stomach through a little hole that was made. But because of VEDS and the weakness of my tissues, I developed what's called a fistula, and that is my small intestine formed a connection with my skin and my stomach. So I have output from there as well. So I have 2 bags to collect the output from the colostomy and one from the fistula.
I'm glad you
And
explained that again.
yes, just a little
Yeah.
refresher. So when you hear the point of today's story will be about the fistula. So you just have to remember it's the one that's not supposed to be there. It is between my small intestine and my skin. And also some background, it's more of a liquidy output. And then the colostomy is like a normal stool output.
It's the
And
liquid.
so, yeah,
The fistula.
no,
Okay.
the fistula, yeah, sorry. The fistula is the little one, the
Okay, okay.
little tiny hole.
I'm with you.
Yes. And so also just some anatomy, when things are digesting through your body, it's going to pass through the small intestine first. So it does pass the fistula part first, and then it goes out through the large intestine and ends out of my colostomy. So the fistula is usually where the food hits first. So just the more you know. And also when I first got the fistula, it was putting out a lot of fluid, like up to a liter every day. And now it's putting out maybe 20 to 50 milliliters. I rarely have to actually drain the bag. So a little bit of fluid.
Wow.
We were moving apartments, and I I don't even think I woke up with pain. I just woke up and I got to it. I was setting up all my gaming desk area here where I am. And I got up, I looked down, and my bag, which hasn't been putting out fluid, had blood in it. And it was not just a little teensy cute pink blood. It was red, and the bag was not full, but it was a
Yeah.
good amount in there. And so we were a little bit concerned because I haven't never had that much blood come out. I mean, sometimes when I mess with the fistula, the skin around it, it'll get irritated and it will bleed, but it will never bleed as much as it was bleeding that day.
Yeah.
So then I got concerned, and I did wake up having a little bit of abdominal pain that morning. It kind of felt like diarrhea cramping. So I didn't really
So
think anything
painful.
of the pain. And it is painful, but I didn't think
Yeah.
anything I'm like, oh, it's diarrhea pain. But I didn't have the runs. which is important to know because it would have come out of the colostomy as the runs. I had normal output. So that coupled with the pain, I was a little nauseous. I told my mom, like, I should probably go get checked and go to the emergency room for this. And so I called my surgeon's team. So my surgeon follows me still from the colostomy surgery when the fistula developed, like, excuse me. And I didn't talk to him directly, but I let the office know that, hey, I had some blood. I sent in a picture. I'm going to the emergency room to get checked. And the nurse called me back. She's like, I left him a message that you're heading into the ER. So my mom and I went to the emergency room. Luckily, I had her with me because she was actually in town helping me move. And so we get to the emergency room. I check in, and we were actually very impressed at first because as soon as I got in, I got called into triage because normally you have to like wait a little bit, then you get triage, and then you wait some more. But I got called back in right away. They were taking it very seriously. They even had my surgeon. I don't know if we've talked about like the tiers of residents and fellows in academic settings. So like residents are doctors already, but they practice under the attendings, and fellows have completed their residency, but they're not full attendings. So fellows are usually like doing the extra time for their specialty that they're in. And so I got called back right away to triage, and my surgeons, fellow and resident, were already seeing me. They were already looking at my bag, like as soon as we got there, which is very unheard of in the ER because we normally wait like hour, 2 hours. They right away ordered labs. I was even put into a room right away, which is like usually the emergency rooms are filled up. Like I'm in a bed in a hallway. I'm waiting in the waiting room because there's just no space. So my mom and I were like, wow, like this is super impressive, right? We were happy. We're like, this is going to be a great ER experience. And then they're like, what we're going to do first is we're going to order labs. And the emergency room doctor was like, I'm just going to order whatever your surgeon's team is saying. So basically like they're in charge. So I'm like, that's perfect. So they order the labs, and with VEDS, we're taught like, it's better to be safe than sorry, and to never leave without a CT scan because we need to make sure that everything is fine within. And so my mom kept telling me, like, it doesn't sound like they're going to do a CT scan. And I was like, well, I'm going to ask for one. Like, we're not going to leave without a CT scan. But I was also like in a little bit of pain. I was sleeping, and I had texted 2 of my doctors that I was going to be there, my cardiologist and my primary care. So they knew. But my mom's like, you should text your vascular surgeon also to let her know. Because some doctors that specialize in VEDS will extend their cell phone numbers in cases of emergency. So I ended up falling asleep before texting my vascular surgeon. And then they have a patient portal. So I saw that my white blood cells were slightly elevated. I mean, barely elevated, but to me that was indicative of something going on, right?
And that's like an infection or something, right?
Yeah. Okay. Yeah, infection. Absolutely. And smart girls. Not only do we listen, but we teach.
Yep.
And so we're kind of like, okay, so maybe there is something going on. But the rest of my labs looked pretty good. And then we're still waiting. Hadn't really heard anything. And then the nurse comes in, and she's like, has the doctor came to talk to you? And I was like, no. And she was like, oh, well, I have your discharge papers right here to go home.
What?
And I was like, but I want a CT scan. And then she was like, well, I'll let the doctor talk to you. So my mom and I were just sitting there like, what the hell, And so also this was the night before a big freeze here in Houston. So they were already like preparing, for the freeze coming in and the snow. And my surgeon's team had even asked like if I wanted to try to get home before that happened. And I was like, I do. That doesn't mean I want diminished care or decreased care, but I would love to get home before the storm comes in because we have to drive back home, right? And so the doctor came in, and she was like, there's like no reason to do a CT scan. Like your labs were fine. And then I told her, I was like, but I would like a CT scan, like with my history. like, I'm basically not going to leave with that one. She was like, okay, well, let me go ask the surgical team that and let them know that you want a CT scan. So she left, and then she came back, and the surgical team actually said no. And I was surprised because it was my surgeon who knows everything that I've been through.
Oh.
And I was like, they said no. And then she was like, yeah. She's like, I also asked, like, I guess she still had a supervisor ER doctor. She's like, I asked him and he said no, there's not a reason to do the CT scan. And I was like, I'm not leaving without a CT scan. And so she left, I guess, to go talk to her supervisor. And they came back with a patient representative. And she's like trying to talk to me about how, like, normally when patients leave, when they're told to stay, that's against medical advice. But this is like the opposite. It's like, I'm not leaving and they're telling me to leave. And I was like, I'm not leaving without a CT scan. And at this point, my mom had actually gone to the restroom. So she left the ER because the ER bathrooms are nasty. She was like, so she wasn't there. It was me handling this.
Dang.
And so I didn't have Mama Bear. And I was telling them, like, I am not leaving without a CT scan. And at this point, I did text my vascular surgeon. And I was like, they don't want to do a CT scan. And I'm here. I had blood in my fistula. And so she was like, ask them to consult vascular surgery, which means like they would, like, vascular surgery can't come see me unless they ask vascular surgery to come see me. And so I told the doctor that. I said, can I, like, my vascular surgeon's asking if you guys can consult a vascular surgery. And then she was just like, I'm go ask my supervisor. And so I texted my vascular surgeon and I was like, they're even being hesitant to consult you guys. And then she was like, have them speak with me. That's what my vascular surgeon said. So I gave them her name. She practices at the hospital that I went to, which is why I went to that hospital. And still, like, they were giving me a lot of pushback. So then that ER doctor, the first one, her supervisor, comes in. And he was like, please mind my words, family, but he was a dick. He was an asshole. So he comes in and he's like, so what can we do to, like, resolve this? I was like, I want a CT scan. And then he was like, yeah. And then he's like, well, there's not an indication. He's like, your labs are fine. He's like, 2 doctors. He's like, ER and surgery. And he's like, and surgery specializes in a lot of things. They see everything and they're much more knowledgeable than us lowly ER doctors. He's like, they both said no. And he was like, we try to be judicious here with our ER services, and it's going to disrupt our ER flow for you to get a CT scan.
Oh,
he was
pardon
like,
me.
He was like, you're going to take away from a patient who needs it. Like, he literally said those words, that I'm going to take away from another patient in the CT scan. And this is me by myself. I was like crying, and I was like, I am not leaving without a CT scan. I was like, VEDS is an indication. VEDS is the indication to get a CT scan. Like, that's the diagnosis that warrants it. And so he was just giving me such a hard time. And I was like, my vascular surgeon asked to speak with you. And he was like, okay. He was like, I'm waiting. And so I was like, okay. So I called her from my cell phone, and I gave him the phone, and he looks at it, and he's like talking to her. And she's explaining to him why I need a CT scan as a VEDS patient. And he was like, well, if we get it's going to disrupt the ER flow, and we're trying to be judicious. And
he loves a buzzword.
Like, he does.
Oh.
And so I heard my vascular surgeon on the other line. She's such a badass. She was like, you're telling me that a vascular EDS patient is going to disrupt your ER flow. And then she went on to tell him that the reason why we need it is because we can have smaller artery dissections that can actually happen without pain and without symptoms. And it's better to catch things ahead than to, like, go back home and then come back, later.
Yeah, that's going to disrupt the flow.
Exactly. Me having to come back. Like, hello? And so after that, he never came back into my room, but they did order the CT scan.
Jesus.
He was such an asshole. And so, like,
That's awful.
My mom came back in, and I was like crying, and she was like, hell no. But we did get the CT scan, and luckily everything turned out to be okay. But I think in that moment, for me, it was like, I was thinking about all my fellow, like, VEDS community, how they don't have doctors like that to talk to them, to advocate for them, or people might not know how to push back against doctors to get the scans that they need. And all I could think about was like the people who have VEDS that go to the ER, they get sent home and they die. Like, frankly, they die. And it was just very disheartening. And it was at a major hospital where we're told like these experiences are going to be better. Like,
And
it was not better. In the end, we were like thankful that everything was okay. I was able to go home with the peace of mind that there was nothing wrong internally, that they didn't miss anything, especially with the storm. Like, what if something was wrong and I had to go back the next day on the icy roads? Like, excuse me. It does get a little bit better with my surgeon's team. So I did have to follow up with them. But I also want to add that the next day I was working on my desk again and I got more blood. So imagine if I did not get my CT scan and I saw the blood again, back to the ER for me.
Yeah.
Yes. And so we realized that it was probably like all the moving and up and down I was doing with the moving, because I rested the rest of the day and there was no more blood. So.
And there hasn't been?
There hasn't been since then. So it was like all that activity. But obviously, like, how are we going to know that?
Yeah, you can't know without the CT scan.
Yeah.
My goodness gracious.
So
I can't believe that whole time you were alone.
I know. And my mom felt so bad. I'm like, girl, it's okay. Like, that's just how it works. If you leave, they're going to come in. And if you stay there. Oh, I was also going to add that it was funny because when they took me to the CT scan, my mom and I were already like, they're going to put you like dead last of the CT, like readiness. And so I was like, what, probably. But when they came to grab me, the tech that was pushing the bed, he was so cute. I loved him. He was talking to me. He was like, yeah, I was supposed to get another patient, but the doctor wants to talk to the patient. So I was like, I'm going to grab somebody else. And I grabbed you. I was like, perfect. So I could just go home. And I was like, in your face, you mean ER doctor.
Mean man. Jeez.
The next week, I had a follow-up with my surgeon. And I was ready to give him my peace of mind and ask why he did not order a CT scan. So I was trying to like think of my way in, because I have that relationship with my surgeon too. Like, he has seen me at my absolute worst, and like, we're besties. And so when he opened the door to come into the room, somebody outside was talking about being aggressive with him. And I was like, perfect. So he came in and I was like, I'm going to be aggressive with you too. And he was like, why? And I was like, why did you not order a CT scan for me? He was like, you were fine. He was like, your labs were fine. There was really no like additional reason. He was like, I told the team that if the labs were fine, you didn't have to get a CT scan, and we wanted you to get home before the storm. And I told him about how I panicked, how I cried, all the anxiety that I had. And he was like, first of all, they never asked me they never let me know that you wanted a CT scan.
Oh.
He was like, I would have. He was like, if you would have asked, if I would have known how much anxiety was causing you, I would have ordered the CT scan. And even the fellow that was in there with him at my appointment, she was also one of the ones taking care of me in the ER. She was like, I didn't get asked anything.
So do you think they were going straight to the supervisor?
I think so. Either that or the resident who was practicing under the fellow, maybe he was the one that was asked. And because of the protocol that my surgeon said, he just said no.
Wow.
So I don't really know what miscommunication there was there. But
or no communication.
Or complete lack of communication. And my surgeon was like, you know how to get a hold of me after hours. He was like, you should have called. And I was like, okay. It turned into him yelling at me.
He said, how can I flip this around on you?
Yeah.
Playfully.
Yeah. So basically everything was good. He said that, maybe like I ate something hard. It scraped the inside of my intestine, caused a little bleed. It could have been just trauma from the move that caused the bleed. But he felt around. He said everything feels fine. My hernia that's there hasn't grown. So we are all good on that front. But it was just like a really sad and like scary situation to be in, because I just felt like I was being like loony, like I was being psychotic. I felt gaslit, like, and I almost wanted them to find something so I can be like, this is why I asked for a CT scan.
Right.
But we're glad that
I'm
we're
like,
okay.
thank goodness they didn't, but still.
Yes.
You never know. And it's like you said, 'cause while you were telling the story, that's what I kept thinking about is like your VEDS friends who have passed away because they
Mm-hmm.
didn't feel anything or they couldn't get that care. And it's so sad because it happens more often than not.
Yeah,
So if
exactly.
you had not given any pushback, like who knows? You know, like thank God this time it wasn't anything serious, but
And just like the way the world works, like
mhm.
if I had not gotten the CT scan, I went home, I bled again, it would have turned into something. Like, I just feel like
Yeah.
that's what, because I got my CT scan, it was nothing. But I feel like
Mhm.
if left just disregarded, it would have turned into something, even though I didn't get treatment. But that's just how the world works.
Right.
It's just how the cookie crumbles.
Period. Well, I'm glad you finally were able to share with me.
Yeah, isn't it crazy? I just like, oh, I wanted to tell you so bad
I
because I
know.
knew how pissed you would have been.
And you left me on like the most like unanswered questions too. She was like, "What did you say? I'm in the ER," and they made me cry or something like that. And I was like,
She was already ready to get the Glock.
"Oh, yeah, I was. I was ready." On the flip end of that, my mom and I were talking the other day about when I almost lost my eyesight. I don't know if we were close back then. Do you know if we were? It was in high school.
No, we weren't. But you have told me the story, but I
Yeah,
have forgotten.
little
It's
bits
really
and
a
pieces
watered down
probably.
memory. Yeah.
So when I was a junior in high school, my very first class of the day was computer class, right? We had these like massive, sorry, I got far from the mic. We had these massive Mac screens and they were just so bright and it was dark in the classroom. And so it normally like hurt my eyes, but that day, like something in my eye was just like blurry and I kept like messing with it. I rinsed it out with water and I was like, okay, maybe it's just the fact that I'm staring at the screen in a dark room, but it was just so blurry and my eye hurt so bad.
And
And
you're
go
probably
ahead.
getting, never mind, you're probably getting there.
Did I wear
I'll wait
contacts?
to ask. Yes. Were you
I
wearing
did wear
contacts at the time?
contacts.
Okay.
Yes, I was wearing contacts at the time. And I hadn't worn contacts until I was in high school. And because of this incident, it only lasted like 6 months. So I was wearing my contacts. I texted my dad to bring me my glasses, and he was working at the time, so he was going to bring them in a bit. But then I go to my second period class, and I like, at this point, I'm starting not to be able to see out of my eye. So I know it was scary. I went to the nurse, and she was like, "Do you have eye drops? Like, let's just take out your contacts." So she got me like the solution. We took them out, and I just waited there for my dad. And the nurse said, "I think you need to take her to the ophthalmologist." Is that what they're called?
Mm-hmm.
Optometrist. It was the optometrist first, though.
Oh, okay.
So we went there, and at this point, my eye, it looks like I'm looking at like a white screen in one of them. Yes.
Oh my gosh.
Like I can see clearly in this one. This one just looks like I'm looking at white, but my eye looked normal to any other person, right?
Okay, on the outside.
But I was like, this is not good. And I wasn't freaking out like probably as much as I would have freaked out now because, mind you, I was like 16.
Right.
I was like, I'm at the doctor's office. It's going to be fine. So they see us, they look at my eye and they're like, you need to get to like the ER. So they sent us to the ER, and when we told them what was happening, they got us back there right away. And like the pieces are coming together slowly for me because I remember that morning was very blurry, like for lack of a better word. It was just very blurry. And I just remember being in a dark room laying down the entire morning. The ER doctor saw me and he asked me about my contacts, and I was like, well, I've been wearing them, but like I just thought they were itching and then I couldn't see. And he was like, I think we need to call the ophthalmologist because that is the eye doctor, right? Like that's their specialty.
Yeah.
Okay.
So they do like the more in-depth examination.
Yes.
Of your eyes.
So that's who they called. His name, can I say names?
Let's not name drop.
Okay, we're not going to name drop.
Yeah.
But yeah, this doctor was not on call that day. They called him from wherever he was, like he was at home. And he came in and they did all like the tests on my eye, and it turns out that I had an ulcer in my eye. I think I'm saying that right. But he explained it to me as like a piece of dust or a piece of something got in between my contact and my eyeball. And then like while you're moving, looking around, like it was just etching itself. Yes. Inside of like the pupil. And it had just been in there. After this, I don't remember a whole lot of details. I remember there was a lot of tests going on. They would put like yellow stuff in my eyeball and they had it like forced open. But whatever they did literally saved my eye. And this man was there from like noon with us to maybe 9 o'clock at night. The entire time. He never left our side. It was me, him, and my dad that whole day. Thank goodness. My two dads. And here's the kicker, though. So I go home. I couldn't see out of that eye for like, I want to say maybe 2 weeks or so. I was wearing an eye patch. And my dad had to wake up with me every hour on the hour to administer these eye drops. And he did that for like a whole week straight. And the doctor, he didn't have to do what he did, but he came in every single day at 4 p.m. to see me. And my parents would drive me to the doctor, and he was there. He wanted to see the progress because he said had we not gone that day, that I most definitely would have lost my eyesight.
You would have lost your vision. That is so scary.
Isn't it scary? But he did that every day for like 2 months. And then, like, of course, as I started getting better, I got the eyesight back. I could take off the eye patch. It was like less frequent. But he went in on Sundays. He went on Saturdays. Every single day until he knew for a fact that my eye was okay. And, like, he could have had somebody else look at my eye for him,
Absolutely,
you know?
Yeah.
But he was just so amazing and so patient. And, like, I cannot get over the fact that he did that. It's my mom and dad's and I's very, like, one of our favorite stories to tell.
Yeah.
Because he was just so amazing. And he was, like, matter of fact. He didn't mess around. He didn't sugarcoat. He just told us what was happening. And I wish I remembered more of what happened that actual day that I went into the ER. But I was just so knocked out. But I just know they took the best care of me. And thank goodness I was back playing tennis after like 2 months. I tried playing with the eye patch. It didn't go that well. It was not good at all. So that doctor is one of my favorite doctors I've ever been in contact with.
Doctor.
Yes, so involved. Like, hello.
I feel like
he was amazing.
I feel like pediatric doctors do a lot better at like comforting their patients and the families. Like that should be for everybody. But I'm so happy that you got that experience because that is something really traumatizing to go through. Is like almost lose your eyesight, and to have somebody there with you every step of the way that's, you know, knowledgeable, that's reassuring you, that's keeping a really close eye on it, that's really important to healing too. Like you have to heal every single piece of you to be completely healed. So
you really do.
That's really cool.
I think it's good that I was like so young and so dumb because I didn't realize like the gravity of it. You know what? Go ahead.
No, I was gonna say, I think if it happened now, you would have been so devastated about watching your shows, your Bravo shows.
I would have been beside myself. Like, I can't do my makeup on the other eye. What do you mean? But you know how I always remember that day? Because my dad was going to pick us up after school. And I wanted to go to Walmart because Demi Lovato's, like, very first CD came out. And that whole time I just kept thinking, like, I'm not going to get my CD. That was, like, my number one concern.
Maybe that was helping you get through, though.
I think it did.
Get out and get this CD.
That was, like, the light at the end of my tunnel. But it was probably my mom's doing. I think when my dad went to, like, go pick up the prescription, she sent him to go get the CD. So I was just sitting there with my one eye looking at the lyrics.
Hi.
So I still got Demi Lovato's debut album.
Amazing story.
Amazing.
We love
Shout out.
learning. Shout out to Demi Lovato.
Shout out. She got me through my one-eyed days.
Thank you for sharing that. That is, it's so important to have a medical team that is there to comfort you in your times of like vulnerability and trauma. It really makes a difference. Little things too. I mean, like that is a big thing for him to just stop by every day after his work days to go make sure that you're doing okay. Like who does that? Literal angels.
They do exist.
Whenever we talk about these stories, I always think about my physical therapist who, I would talk to him in depth about my medical care and my situations. And he would always say, like, unfortunately, these great doctors and great experiences are the exception when they should be the standard for everybody in healthcare. And I know it's tough because of, like, policies and documenting and everything that's weighing on them. But, like, I think it's part of your job. Like, that's part of the experience that you're giving your patient and part of helping them heal. And, they need to feel like they're in a safe space. And so why are you going to be, like, essentially, like, verbally attacking your patient or not hearing them out or anything? Like, it's literally your job to hear their concerns.
Exactly. So thank goodness for doctors with patients. Like
with patients and patients.
Yes. That was a good one.
That was good. There's a lot of puns on this one with your eye where you're blind, whatever you said. Or blurry.
Blurry.
You were like, it's all blurry that day.
We're also part-time comics, if you didn't already pick up on that.
If you keep listening to our shows, maybe we'll tour.
Not the tour.
We're going to open for Beyonce.
Oh, period. Cowboy Carter World Tour. Featuring Bella and Miranda, the divas who listen.
Beyonce's a diva. It only makes sense.
She is. She's our third diva. You guys just didn't know. All right, friends. Well, with that being said, we are going to close out this episode. Thank you for listening to our stories. And thank you for listening to my story, Isabella Marins.
Thank you.
If you would like for us to read your stories anonymously, you can send them in through the link in our bio. Is that correct?
Yeah, it's in the link tree.
It's in the link tree. Oh, we have a link tree?
Yeah, well, Investigator does.
Oh, okay. You can also plug for Investigator on Instagram. That way we can continue with this and giving you our thoughts and hearing from you guys, because that's what we like. That's what our whole shtick is built on.
We also like tea, so we love to hate.
Oh, my God.
But we also love to love. We love a good doctor.
Yeah, we really do. A good, cute doctor.
Especially. Feel free to include details.
Please, send them to me directly. I'll take them. JK. All right, we gotta go.
Okay, yes. Thank you all, and we'll see you on the 17th of next month.